Hello, sir. Good evening.
Hello.
Hello, sir. Good evening.
Hi. Good evening. Well, good morning in my case. So, what time is it where you are?
I'm from Pakistan.
What time?
It's 3
Yeah.
p.m.
What?
It's 3
3
p.m.
p.m. Okay, very good. Yeah, very good. Okay. So I'm just checking. You are Zaud. Is that?
Yes,
Am I
sir.
saying this right, Zaud?
Yes, sir.
Yeah.
Saud Javed.
Okay. So, I still need to just quickly download your application documents. You didn't reply to my email, so I wasn't assuming that you would be coming. Okay. So I'll just quickly get your documents. So stay on the call. Okay. I'll
Okay.
just get your documents and then we can start. Yeah.
Okay, sir.
Yeah. So 2 minutes. Okay. So can you hear me? Okay.
Yes, sir. I can hear you.
Yeah, very good. Okay, so thank you very much for your patience, and thank you for your application to the MSc program, the MSc Investigative Ophthalmology and Vision Research here in Glasgow, at Glasgow Caledonian. I had a quick look at your application documents, and as I said, I didn't get to take a look at this before because you didn't respond to my email. Well, at least I didn't see a response. And first thing I noticed was that there's no CV, so I don't know what your work experience is. So I thought maybe we can use this interview. You can tell me a bit about your work experience, yeah, and
Sorry,
your
sir.
clinical
Sorry to
experience.
interrupt you. You are not quite audible.
Okay, so can you hear me better now?
Yes, sir. May I can close?
Yeah. Okay. Right. So I had a look at your documents, and there was no CV. Okay. So I no resume. I don't know your background. I know your degree,
Okay.
but nothing about your work experience. Can you tell me a bit about your work experience? What is it you do at the moment, and how many years of work experience do you have?
Okay, sir. Sir, I am an optometrist and I work in an independent eye setup from the past 3 years,
Okay.
managing refraction, orthoptics, and investigative uh, diagnostic procedures there.
Okay. So when you say diagnostic procedures, what does that involve?
Well, it involves foreign body removal and also some diagnostic procedures for cycloplegic refraction and also the fundus examination.
Okay. And when you say fundus examination, how do you do this? Which technique, which instruments would you use?
Well, I use slit lamp and the 90D lens for the fundus examination.
90D. Very good. Okay, good. And I know that optometry is practiced differently in different countries. Okay,
Yes.
and we often have students from Pakistan. Well, every year we have students from Pakistan, and I know in different clinics people do things differently.
Yes.
Now, when you work in an independent practice, okay, is that your normal way of working, doing fundus exams? Because I know some of your colleagues are not allowed to do that.
Yes, sir. We are allowed to practice fundus examination in a private setup.
Okay.
It's a normal
Okay.
practice.
Very good. And it's normal. Okay. Good. And if you find something abnormal, what do you do with that patient?
I usually recommend them to the ophthalmologist for further
Okay.
diagnosis.
Okay. And the ophthalmologists, are they in your own practice? So is it like a
Yeah, I
like
have.
a shared care practice? Or
Yeah, I have hired recently an ophthalmologist in my clinic for the surgery procedures.
in your clinic? Okay. Okay, that's very good. That's great to hear. Okay, so beyond 90D, so 90D is a really good technique. Is what we use here in Scotland a lot as a routine instrument.
Your voice has
What
been
other
disrupted.
Here with? Second. So what other clinical techniques are you familiar with? What else do you use?
Well, I use orthoptic techniques, prism bars for the assessment of children,
Okay.
for the orthoptic assessment of children and finding amblyopia-like conditions and other strabismus conditions.
Okay. Good. And what about things like intraocular pressure and visual fields? Do you do that at all?
Yes, sir. I do perform the intraocular pressure test through our slit lamp machine, and also we have
Okay.
the newest technology for that also.
Okay. So how do you measure the IOP? So how,
Well, we have the tonometer.
What
We have the
technique
tonometer
do you
for that.
use for IOP?
We have the tonometer for that.
Yeah. What kind of tonometer?
It's the
What kind?
it's the digital
So
tonometer.
is it like a contact one or is it non-contact?
Non-contact one, sir.
Digital. Okay. 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 Good. Okay. That's fine. Okay. And you said you've been working for the last 3 years. Is that right?
Yes, sir.
Yeah. Okay. And when did you do your internship? So I think you normally do your degree and your internship. When did you finish that?
Well, sir, I was practicing during my studies. I had a lot of time to work with the optical shops to gain my experience up there. And after qualifying,
Okay.
after completing my graduation, I did my internship with the tertiary care hospital. And along with that, I started my independent setup part time. And after completing my internship, I started it full time.
Okay. Okay. So it's I didn't get earlier. So you're the owner of the practice?
Sorry, I can't hear you.
Did you say this is your own practice?
Yes, sir.
Are you the owner?
Yes,
Yeah.
sir.
Oh, right. Okay. Okay.
Yes, sir, I am the owner.
Okay. Good. Okay. Very good. Yeah. Okay. Good. Okay. Great. So that's really interesting. So I think this is great. You've got good work experience, and the reason I'm asking this is that we just to ensure that you bring a good baseline of knowledge, because we recommend at least a year, 1 year of work experience, and you certainly have that. You've got good something.
Sorry, sir, you are not audible again.
Hi, can you hear me okay?
Yes, sir, I
Okay, Saud, quickly in terms of your project experience, have you ever done a project before? Like a
Sir?
research project or final year project?
Yes, sir, we have done the research project. My topic
Okay.
was frequency of common eye diseases in children among 3 to 5 year children in a tertiary
Okay.
care hospital.
Right. What did you find? Do you remember?
Yes, sir.
What was the main finding?
Yeah, the main findings were the adnexa in almost, if I'm not wrong, 90 patients, and conjunctivitis in 35 patients, and the total patients we have assessed was 350 patients. Out of other, we find some other diseases like the congenital cataract and other basic infections
Things like that. Yeah.
like the
Very good,
nasolacrimal
yeah.
duct blockage, etc.
Yeah. Okay. Great. Okay. That's fine. Okay. Saud, what are you hoping to gain from the MSc? So I know you've set up your own practice. So I'm sure you're busy working in your practice and making sure it's flourishing. So what are you hoping to gain from the MSc?
Will you repeat the question again, sir, please?
Okay. So what are you hoping to get out of the MSc? So why are you applying? What's your reason?
Okay, sir. Sir, my main mission and objective is to become a researcher and pursue my career as a teacher along with my clinic. And for that, it's kind of it's eligibility criteria nowadays to have a master's degree after bachelor education to pursue your teaching career. So
Okay.
it would help me both in the clinical aspect and also in my teaching aspect.
Okay, very good. Okay. And I understand that, because this is what many of us have been doing, sort of after graduating, working, doing an MSc, and maybe a PhD even. But how would that work with your practice? So would you close your practice when you come to Glasgow, or would somebody else be running your practice?
No, sir, I won't be closing my practice. I already have hired an optometrist for my setup, and also now we have the ophthalmologist. So they will be running the clinic. I have given them equities in my clinic, so I won't be closing it. And after completing my graduation up there and taking some skill up there, and I will be again joining that clinic.
Very good. Okay, thank you. Yeah, that makes sense. It's good to have somebody to run it for you while you're
Yes.
away. Okay, so that's fine. My last question is, how did you hear about the program? Where did you find the information about the MSc?
Well, I was searching for the optometry clinical courses, and after making a thorough list of universities, I found out that the GCU is one of the best university that I can have on my panel. So I have searched it from the Google source.
Okay. Okay, great. That's fine. So it's good to hear that you found us online. That's really good. So there will also be an opportunity for you to ask me any questions. Okay. Zoud, I hope you can hear me. Okay. Yeah. So if you cannot hear, if the sound is not good enough at your end, please type any questions in the chat. Okay, Zoud. Yeah. Just give me an okay if you've heard. Okay.
Sir, will you repeat the question?
Yeah. Okay. I'll type in the chat. Yeah, look in the chat. Okay. I will just for information. So I'm communicating with Saud both via my microphone and the chat. So because I think the sound quality is not great for him. Okay. So thank you both very much for your information. I think both of you. You're meeting the criteria for the MSc. I'd be really happy to make you both an offer. Yeah, so that would be fine. I would just like to say that you need to be prepared for quite an intensive year of study. So the MSc is a 1-year full-time program. You may have seen this, and it is quite intensive. Yeah, so you will be sort of starting slowly, and then your workload will be building up over the course of the year. The program starts in the middle of September. Okay, so I think it's the 15th or something of September, and we recommend that you try to be here at least 2 weeks before that. 2 weeks before. And that's important because you need to settle in, you need to do your police registration, you need to register with a medical doctor, you need to make sure your accommodation is okay, and all of these things, ideally you would be doing before your teaching starts, yeah, before you come to campus and really meet your classmates and everyone else. So in terms of the program itself, you may have seen it is a very international program. It's designed for practitioners, for optometrists like yourselves, okay? So the class typically is a cohort of international students. We usually have students from Pakistan, from India, Nigeria, Ghana, often students from the Middle East as well. And the size of the class is usually between 20 and 25 people. So it's a good size in a sense. You will meet everybody. You will find it hopefully quite easy to make friends and also learn from each other. Yeah, so that is I think is quite nice. It's quite a nice size and quite a good group to study with. Yeah. The university itself has a large community of international students as well. So again, you will find there are lots of other students doing all sorts of postgraduate degrees, master degrees. And in terms of your living, I think what I can see, Glasgow is, I think, a good place in the UK. It's very welcoming. It's not as expensive as other places in the UK, so it's a good balance and a good place to be and to study. You want me anything you would like to ask or anything you'd like to know about the program or coming to Glasgow?
So.
Yeah,
go for it. I like to find out if there are some form of funding or scholarships for this program.
Yeah, not specifically for this program, but for students coming to GCU. Okay, Simon, I'm not sure if you've seen this. There is, and I can post this in the chat here. So on the website, there is a scholarship site, and I would strongly recommend have a look at this because it changes from time to time.
Okay, sir.
Hold on, I posted the link in the chat. So it's postgraduate scholarships, and here's the link. Okay, so look at this and check from time to time because sometimes it does change. As I say, this is not program specific, but for any postgraduate program. So you may want to take a look at that and see if there's anything that is applicable. What students sometimes also do is they look at external scholarship opportunities. So there's a Commonwealth scholarship, for example. I'm not sure about the deadlines, but you'd have to look and see if these are currently open and available. And we've had students come on Commonwealth scholarships and others. So these things, they may be country specific. So you need to check these out. But I know they are available, and from time to time it may vary a little bit. Hopefully that helps. Yeah.
Okay, sir.
Okay. No problem. Any other questions?
Sir, I want to know that when will we get our unconditional offer letter after this interview?
Okay, so what happens next is, once we've finished this call, I will give my recommendation to the admissions office. Okay, and you should hear from them within the next few days. So you should get an offer very, very quickly. What I don't know is whether it's conditional or unconditional, because you need to make sure that you've submitted all the documents. So what I said to you earlier, you did not submit a CV, okay? So the admissions office, they may ask you to submit your CV first.
Okay.
And also if there are any other documents missing, you need to make sure you submit all of that reasonably quickly, and only then can they make an unconditional offer. Yeah.
Okay.
So keep an eye out on the information you're getting from admissions. Yeah. But I would pass on my recommendation today, straight after the call, and then you should get feedback very quickly. Yeah.
Okay, sir.
Okay. Yeah. In terms of the program, just before we finish off, is just to say, the program has two main pillars or elements. Okay, so one's the clinical side, and Thairul, I know you said you'd like to develop your clinical skills, and that's also the research side, and so we try to help our students develop their skills in both of these areas, and that should help you with your clinical practice, but also if you want to get into teaching later on, if you want to become involved in academic teaching, for example. Saud said he's interested in doing that, becoming a lecturer or developing his lecturing skills. So the feedback from our students, from our graduates, is that the program is a good basis to really develop these skills. We also have the technology aspect, Thairul, that you mentioned. So you will be exposed to technology, but not all the time. Okay, so there's a whole mix of things that we use. In terms of teaching methods, you will be exposed to things like OCT, ultra-wide field fundus imaging, and things like that. But you will also be using kind of manual methods. Think prism bars, think cover test, so there's a whole range of aspects. Now, the bulk of the technology teaching is part of the advanced clinical investigation module, and that's in the third trimester. So we have 3 trimesters, and that's basically the summer trimester, and that's probably where the bulk of that is happening. Yeah, but don't despair. There's a lot of other things which hopefully you will find interesting. But as I said, be prepared for an intensive year of study. Again, this is from the feedback from our students. Students are saying, yes, it is quite an intensive year, but I think that's what an MSc is meant to be. Yeah, so 1 year of good input and interesting things to learn. Yeah. Okay. Good. If you have no further questions, then we'll stop here. If there's anything later on that you want to ask, you can email me. Yeah, so you've got my email contact. Don't hesitate to ask if there's anything else I can help with. But for today, I'd like to say thank you again for coming. It was very nice meeting you both, and hopefully we'll be able to see you in September. Yeah. Thank you, Saud.
Thank you, sir, for
bye-bye. Bye.
Thank you, sir.